Hi, and welcome to another video presentation on cognitive assessment. This is the second presentation in a series of 4 addressing the complex topic of objectivity. Over the past 15 to 20 years, neuropsychology has moved toward increased objectivity of a certain sort that involves an increased dependency on test scores. 2 recent books on forensic neuropsychology illustrate this point. Glenn Larrabee's book is subtitled A Scientific Approach, and Kyle Boone's book is subtitled An Evidence-Based Approach. Both of these authors are highly involved in the malingering and effort test area, and much of their focus on objective test scores comes from this perspective. I believe that this is too narrow a view of objectivity. It tries to eliminate, or at least minimize, the subjective involvement of the clinician, and thus it increases the clinician's dependence on scores alone. Clinician then begins to question the reliability and validity of these scores, accentuating the concern about possible malingering. This leads to the creation of what I have called the adversarial clinician. The adversarial clinician is no longer primarily concerned about establishing an empathic connection to each patient, but instead is suspicious and distrustful of patients regarding their possible poor effort. A more enlightened view of objectivity can be found in what I think of as a wonderful book by Dalston and Galliston called Objectivity. In this book, they show that the meaning of objectivity has changed over time, and in one instance even reverses itself. They show that a purely mechanical objectivity is inadequate in recognizing functional patterns, and neuropsychology, of course, is all about functional patterns. The experienced observer remains essential, in their view, in bringing a judgment-inflected vision to the evaluation process. The objective losses by not observing closely and paying attention to what one sees and interacting with patients is very costly to the final evaluation. Next time, I'll look closely at the context of the test performances.